Hi, this is Charles Reynolds again. Here's a really interesting question from one of our providers. Dr. Reynolds, how are you? Hope all is good. This is great. Patient question, please. 70, and by the way, the reason she said it's great is she's loving the procedures. Patients are getting well. It's helping her cash flow at her office. This is one of our nurse practitioners out of Texas. Patient question, please. 70-year-old man presents to the office stating that he has enjoyed 5 to 7 days of sexual activity with his wife, status post penile implant at the age of 66. I imagine she means 5 to 7 years of sexual activity because he's 70 years old. Okay, so the man's 66, he had an implant. He's 70, he had an implant when he was 66. And he's getting, so he's had 5 to 7 years of sex after the implant. Reports prior to the implant that he had to take Viagra daily or nightly in order to obtain an erection. Penis is 6 inches erect, 4 circumference on the outside, and 2 that stays within canal with girth just under 2 centimeters. He is still able to ejaculate, and he has some sensation. However, would like more. Would this individual benefit from the Priapus shot in any way, as he is sure as I am about blood flow status post-implant? By the way, the wife also enjoys sex daily and is 56 and scheduled an O-shot. Beautiful. This is why we do what we do. These people are too young to quit having sex. 70 years old, you've got your brain, you have time. Hopefully you're not having to work so hard for money. But either way, this is beautiful. Romance at 70 and 56. I'm 56, by the way, so too young to stop having sex. Questions. There's several embedded in this. One is basically, is it okay? Because it said, with this individual benefit, he is sure as I am about the blood flow status post implant. Well, the blood flow would be adequate in order to have healing. And as a matter of fact, at least one of our urologists, Dr. Bano, uses the Priapus Shot pre-implant to get the penis ready for surgery. There's evidence that it helps in multiple procedures. Hysterectomy, here's one that I pulled up where someone is using PRP as part of their procedure to remove mesh when it's exposed. And with good results. We've been seeing for the past 7 years that just the O-shot by itself helps the pain of mesh in almost everybody you do it with. Now, of course, with this surgical procedure, they remove the mesh because it was exposed. But the problem is, of course, when you remove the mesh, you can make the vagina short and smaller. And so trying to salvage the tissue is a big thing. And the plasma helped heal from that surgery. So blood flow, PRP will not damage blood flow. It will help blood flow. Now, as far as some sensation indicating that he would like to have more. If you look back at this, if you just go to the home page on the Priapus Shot website, I put a link to a paper in the medical literature about using platelet-rich plasma to rejuvenate the nerve tissue in the penis of rats, where they modeled damage. Here we go. They modeled damage as you might see with prostate surgery, cavernous nerve regeneration in a rat model. If you go back to PubMed and you just put in platelet-rich plasma, and nerve regeneration, that's nice, right? 35 papers. So this is beautiful. This is why I think we're seeing it is already being used and helping. So this is why our group helps, I think. This is a study that needs to be done. There's so many studies that need to be done, but a study that needs to be done that shows that it improves sensation with implants. One of our urologists needs to do that. One of our urologists needs to do, or one of our family practitioners, surgeons, gynecologists, someone should do the study showing that PRP decreases pain when in people who have chronic pain from mesh. We've been seeing it for 7 years. Someone please do that study. So yes, the chances are this would help. Now here's the caveat though. Doing injections around an implant in the penis is like doing them around an implant in the breast. Either way, you should be careful about how you're approaching it so that you don't puncture the implant. Ideally, this should be done as part of the procedure, prior to the procedure and part of the procedure, and maybe a month post-procedure, in my opinion. So you guys work with it. Hopefully some of our urologists will contribute more to this. I would do it with the permission and under the acknowledgement of the surgeon who did the procedure. And hopefully more surgeons will take a clue from some of the urologists in our group and start making this what they do. But in the meantime, the answer is absolutely yes, with carefulness. And I look forward to more comments from the urologists in the group.